Welcome, students, faculty, staff, family, friends, alumni, and members of the Executive Advisory Board to the first CUNY School of Medicine graduation. To our amazing pioneering class of 2020. We celebrate your becoming our colleagues in this most noble and essential profession. We thank your family and friends for helping you be successful through this arduous journey. I want to acknowledge that we are gathered on the unceded land of the Lenape peoples, and am recognizing the Lenape community, their elders, both past and present, as well as future generations. I also want to recognize those we've lost to COVID-19 and to all the essential personnel working tirelessly to provide healthcare and services to all of us. Every person we have lost to this horrible pandemic has a story and a community of loved ones in mourning. Let's take a moment of silence or prayer to remember and honor the victims and pay tribute to our essential workers. I want to thank the Sophie and Leonard Davis family and the founders of the Sophie Davis Biomedical Education Program for creating the program that allowed this to happen. I also want to recognize all of the faculty, staff, alumni, and St. Barnabas and Staten Island University hospitals, without whom we would not be here today. Class of 2020, you are the class of many firsts. The first students to enroll in the CUNY School of Medicine, the first to experience our new integrated curriculum, fundamentals, organ systems, research selectives, LCE, and the practice of medicine courses. You were the first students at our clinical affiliates, in our clerkships, and going through 3 LCME accreditations. We celebrated with you at our first match day, and now you were the first graduating class of the CUNY School of Medicine. Your class has provided critical feedback about our school, our courses, and assessments that have helped us refine and improve our curriculum and the learning environment. You have shown your resilience in weathering many challenges, including significant leadership changes, being pulled from clinical rotations, graduating early, and being deprived of in-person celebrations for your residency match and graduation. And now, the greatest crisis of our times, COVID-19. Your class is known for many things: academic excellence, kindness, generosity, and spirit. We are all so proud of your accomplishments and commitment to our school and clinical affiliates, especially St. Barnabas and Staten Island University hospitals. We are so grateful you chose our program. We are so lucky to have been your teachers and advisors for 7 years and to be here now to see you become physicians. You have become a physician at a defining moment for the medical profession. In this pandemic, we are yet again witnessing another demonstration of the disproportionate impact of disease and health inequities on minority and economically and socially disadvantaged communities. You have been well trained to identify and address health inequities and social determinants that adversely affect health and well-being. The legacy of unethical testing and treatment of communities of color means it is critical for you to create and foster trust and develop alliances to diminish the healthcare disparities magnified by COVID-19. In the words of Dr. Martin Luther King Jr., we are now faced with the fact that tomorrow is today. We are confronted with the fierce urgency of now. In this unfolding conundrum of life and history, there is such a thing as being too late. This is no time for apathy or complacency. This is a time for vigorous and positive action. You are our hope for the future of the healthcare profession. You have all demonstrated you are up to this challenge. Just imagine what can happen if you all raise your voices for those who don't have a voice and enlist others in addressing inequality. For over 3 decades, I've kept a folder where I have reminders of why I chose the medical profession. There are thank you notes from patients and students, award notifications, photos, memories, and messages from colleagues when I changed institutions. Each of you needs to keep this kind of folder, a sunshine folder, to lift your spirits and make you smile. Being a physician is tough. The days are long. You often take your patients' problems home with you, and you never have enough time to keep up to date. There are bad outcomes, even when you do everything correctly, and also when you don't. But the rewards are many. You will be privy to getting to know people and learn about their lives in ways that no one else can. You will be rewarded by working with amazing peers, faculty, and staff, and will constantly be learning from and with them. Many of these relationships will be long-lasting. You will never be bored and constantly be challenged. Find colleagues, partners, and friends who can mentor, champion, and support you. You will need hope and courage. Remember to keep joy, laughter, and fun in your life. Tinsley Harrison graduated medical school at age 22 and was one of the most important medical figures of the 20th century. He was not only a physician, but also a scientist, educator, and department chair. To paraphrase his preface in his seminal internal medicine textbook, Harrison's Principles of Internal Medicine, no greater opportunity or obligation can fall to the lot of human being than to be a physician. In the care of suffering, you need technical skills, scientific knowledge, and human understanding. You who use these with courage, humility, and wisdom will provide a unique service to your fellow human beings and will build an enduring edifice of character within yourselves. Physicians should ask of their destiny no more than this and should be content with no less. And so, to our inaugural 2020 graduating class of physicians and fellow colleagues, pursue your unrealized possibilities. We can't wait to see how you will change the world. Congratulations from all of us.